listen to all the valves with the bell of a stethoscope too, as well. I do not see his jugular veins, so he has no jugular venous distension. I'm going to palpate all of his pulses. I'm going to feel his temporal pulses first. And his brachial pulses. Radial. And the ulnar. And his popliteal pulses. And his dorsalis pedis and posterior tib. Of course, he's young and healthy, so he has good pulses everywhere. Now I'm going to do the Allen's test. So what I want you to do is open and clench your fists for me several times. Okay, now leave it open. I'll let go of his ulnar artery and watch his fingers turn back to red. And they do, so that's good. I'm going to check his nails for color and temperature and capillary refill. He's got good color. His temperature, they're kind of cool. And he's got good cap refill. And then I'm going to look at his lower extremities. He's got equal hair distribution on both legs. He's got good temperature. His skin color is normal. There's no redness or any strange colors. He has no varicose veins. Now I'm just going to feel his head and his neck and upper body for lymph nodes. Feeling it there. Okay, now first I'm just going to assess the contour of his abdomen, and it's flat and symmetrical. And test for hernias. I'll tell him to take a deep breath in and out. Can you take some deep breaths for me? And I'll just watch for any unnatural bulges that come out, and I don't see any. You can be normal. I'm going to listen for bowel sounds and for his aorta. He's got normal active bowel sounds, and I do not hear any bruits in his aorta. Now I'm just going to percuss for his liver and his spleen. So I'm going to feel right under his rib cage and look for the dullness compared to the resonant sound of air in the intestines. And then his spleen will be over on this side. Okay. And then I'm I'm just going to palpate the whole abdomen, look for any signs of tenderness. I'm going to start with lightly palpating, make sure nothing's hurting. Is that hurting? Okay. Okay, now I'm just going to palpate for the liver and the aorta. One method I can do is reach back this way and have him take a deep breath in. And I should feel the ridge of the liver come up and touch my fingers. And that should be just right under his ribs. If it's any lower than that, it's enlarged. And I can check for the spleen over here by supporting it here and having him take a deep breath again. I did not feel it, and most of the time you shouldn't feel the spleen. And then I will look for the aorta. Just feel for the pulse. Okay. And then I'll test for his reflexes, which his abdomen comes this way when I scratch him just a little bit. And then his femoral pulses would be right in between the inguinal area, just right in here. Okay. Now, I'm just going to have you sit up for just a second. I'm going to get my tools for the neurological test and I'll be right back.